autonomous heart is working overtime to get the job done. Let's have a look. The heart is the pump in our bodies, delivering blood to the entire system through a set of pipes, or blood vessels of all sizes. Smoking, high cholesterol, diabetes, obesity, physical inactivity, family history, and increased age all contribute to these blood vessels, or our pipes, becoming less elastic. The more blood our heart has to pump through stiff, narrowing arteries, the higher our blood pressure. When the force of the blood against our artery walls is too high, life-threatening health problems can result. Problems like kidney disease, heart disease, stroke, even heart attack.
Hey, I'm Eric Whiteside for Whiteside Tackle Solutions. Today, we're going to talk about hypertension. You know about hypertension. You've heard of it as high blood pressure. You heard this term so many times before. Even some of your family members may actually have high blood pressure or hypertension. We're going to talk about it. That way you will have a good understanding of it. And I'm not going to go too detailed on the medical aspect of it. I'm trying to keep it superficial and civilian friendly as possible. So if you take a look at the screen, hypertension, and you'll see these medical abbreviation, either it's going to be HTN or HT. It's known as high blood pressure. It's a long-term medical condition in which the blood pressure is pushing on the arteries at a high level. When you're doing the blood pressure, you actually have two numbers. You have that top number and you have that bottom number. That top number is what we call the systolic. And that's when the heart is actually squeezing. As the heart squeezes, it is pushing blood throughout the arteries. And as it pushes blood through the arteries, there's a lot of pressure there. And the tighter those arteries or the more clogged those arteries are, the higher that pressure has to be or the higher that force has to be to push the blood through. The bottom number is your diastolic. And the diastolic, that's when the heart is actually relaxing. So when you hear that love dub, that love is the heart contraction, that dub is the heart relaxing. So that top number, when you take a look at it, is what we'll call the systolic. That's when the heart is actually squeezing. And the bottom number is your diastolic. That's when the heart is actually relaxing. Take a look at the bottom, on the bottom left side, that is the picture we're referring to for systolic and diastolic. And on the right side is your typical blood pressure. In this chart here, it breaks down your blood pressure because people are like, well, what is normal blood pressure? This is what we're talking about when it comes to normal. Again, don't freak out because some people are like, well, my blood pressure is around 128. That doesn't mean it's elevated. Just relax for a second. I'm going to explain that. What they're saying is normal blood pressure or textbook blood pressure is 120/80. So that's textbook. If that top number, your systolic number is lower, that means it's good. The bottom number, the diastolic is lower, that's good as well. But if you're 122/80, that is still normal. So understand that part. And when the slightly elevated, where you see where it says elevated is 120 to 129 for your top number, and that bottom number, your diastolic is less than 80, that's still good. So anywhere from 120 or lower, I don't want to say too low, but 120, 117, 118 to 120, or even 118 all the way up to 126 is typically good. Now, when you push it going to that 130, and notice the color, it is color coded what we call our yellow, similar to a stoplight. You have your different stoplight. Green means go, means you're good. Yellow means slow down, there's a warning, and red means stop because something bad is happening. So in this case, you see that section that is yellow, 130 to 139 for your top number, and that bottom number is 80 to 89. So that means slow down, pay attention to what you're doing. It could be your diet or something of that nature. So you want to take your time and figure out what exactly is going on. So that's a warning sign for your body. The next one, what we call stage 2, and this one, notice is what we call a pinkish. So say, hey, we're starting to get into trouble. It is now 140 or higher and 90 or higher. So we need to go see a doctor, figure out what's going on. And the last one is what it says higher than 190. If it's higher than 190, you're knocking on the door to a stroke. So when we say 190, we're talking about that top number. It's higher than 190, you're knocking on the door to a stroke. So you want to be careful and figure out what's going on. That bottom number, the diastolic, should be low. But if it's high, when your muscle or that heart is relaxing, there's a major concern there. So you need to go see a physician. And in the chart, the same thing. So you have your pre-hypertension, what we call stage 1, and notice the range. Anywhere from 130 to 139 for your top number, your bottom number, anywhere from 80 to 89. Stage 2 is hypertension, and hypertension means you actually have high blood pressure now. That is 140 to 180 for that systolic, and that diastolic is anywhere from 90 to 120. Again, that bottom number, if it's getting above 90, it brings a concern. So anytime we're doing a blood pressure and we notice you have elevated blood pressure, specifically that diastolic, there's a problem there and we want to check it out. Hypertension, we're going to hypertensive crisis, that's above 180, 190. There's a major concern. So note that is a bright red, means stop, get checked out now. And yes, when it comes to pregnancy, there are some females that will have, there's so many different medical conditions when it comes to pregnancy. One of them is pregnancy-induced HTN, that again, the HTN stands for hypertension. So pregnancy-induced hypertension. And that's because of a large amount of hormones being produced and a large amount of enzymes being produced during the pregnancy. But once that baby is passed through and birth, the body tends to go back normal. Females, you may have pregnancy-induced hypertension, or pregnancy-induced diabetes, but then after delivery of the baby, it goes back to normal. Now, when it comes to blood pressure or high blood pressure, there are some risk factors. If you take a look at the top, age is one, family history, dietary, lifestyle, and your race, your ethnicity. So when it comes to age, as we get older, our vessels get weaker. As they get weaker, yes, the body will have to have more force to push the blood through. So that's one thing that's given. I'm not saying you're going to be old, 90 years old and have high blood pressure. There are a lot of healthy 90-year-olds. But it just means with age, our body begins to weaken. It doesn't run as efficiently as it used to. When it comes to family history, this is high cholesterol. So again, watch that fatty foods. Diabetes, specifically type 2 diabetes, not really type 1 because you're born with that, but type 2 diabetes, and also obesity. Having any of these categories put you at a higher risk for high blood pressure. Now, if you take a look at the next one, dietary, eating those fried foods. We love to eat that fried fish, fried chicken, things of that nature. So again, monitor that. Excessive salt, everything needs to season and to taste better. You don't have to put salt on everything, so be mindful of that. And also on the other end, low potassium. They tell you eat a banana. And when it comes to potassium, I won't get into too much specifics, but it's one of those ions that help with the muscle contraction. Now, when it comes to lifestyle, sedentary, so get up and be active. So if you're not active, or if you have a high demand or high stress job, that can also put you at a risk for having high blood pressure. Smoking and alcohol, those are other things. So you want to monitor that. And lastly, when it comes to race, ethnicity, it is commonly known for African Americans. I'm Black, so it's commonly known for us to have high blood pressure. And that leads back into the previous excessive salt on the food and fried foods or any type of fried food. So we need to be careful of that. So monitor that stuff, because if you have high blood pressure, you want to bring it down. Bringing it down means you're monitoring and being more truthful to yourself, saying, do I really need all this salt? No, you don't. So ease up on the salt. Did you know that blood pressure higher than 180 over 120 is truly considered a hypertensive emergency or even a crisis? If your blood pressure gets this high, you're going to have other side effects. You may have a headache, visual disturbances, shortness of breath, tightness of the chest, anything of that nature. If your blood pressure is truly this high, you need to get checked out. Don't wait, because now you're literally knocking on the door to death, or you're knocking on the door to a stroke. So you want to get checked out. Don't wait till the last minute. That's one thing that a lot of us do. We wait till the last minute. We won't see a doctor until something is wrong. Why do that? You want to be preventive. Again, that's what they say, preventative medicine. So you want to prevent this. So you want to see a doctor. If you have medical insurance, you're paying for it. So go see the doctor. And even if you don't have medical insurance, see a doctor. You don't want to wait till the last minute for any of this stuff to happen. Comes to high blood pressure, especially for a hypertensive crisis. If it's left untreated, like we said before, heart attack, stroke, or other health problems such as kidney problems, it can shut down the kidneys because you're putting a stress on the renal artery. So you want to be mindful of that. Please, please, please make sure you get checked out. If you're diagnosed with high blood pressure, you should at least have a monitor there so you can measure your blood pressure on not a monthly, but at least a weekly basis to make sure that that pressure is under control. Don't wait till the last minute. These are some signs and symptoms of high blood pressure. Severe headache, blurred vision, dizziness, nausea and vomiting, chest pain, shortness of breath, or irregular heartbeat. If you're suffering from any of these, definitely go see a doctor. When you go to the doctor or to the hospital, when they check you out, they're going to check you out for any of these. Tell them, hey, I'm having a bad headache. Because when a patient comes to me and I'm having a bad headache, that's the first thing we check is the blood pressure. If they have high blood pressure, are you taking your pressure medication? If not, why? Or I'm having problems seeing. Check your blood pressure. What is going on? Again, you have arteries behind your eyes. So you want to make sure that those are actually relaxed, because if it's a high pressure around behind the eye, then it could cause problems like blurred vision or even more. You can lose your eyesight. So you'll be mindful of this. Management and treatment. There are two ways. One is lifestyle modification. I always tell people, lifestyle modification is the first thing. If lifestyle modification doesn't work, yes, then we're going to the big farm company, and look for pharmaceutical therapy. But first is lifestyle changes. Changing the way you eat, your eating habits, exercising, getting up, moving around. You may have to change to a less stressful job, or do types of stress management to help in that type of job. So lifestyle modification is the first way. If that doesn't work, then yes, we then say, hey, let's go the pharmaceutical route. But again, first we say lifestyle change. When it comes to lifestyle modification, weight reduction, there's something called DASH diet. And when it comes to the DASH diet, it's broken down dietary approaches to stop high blood pressure. So watching how you eat, that's your dietary. Decrease salt intake. That doesn't mean eliminate salt altogether, but instead of just shaking the salt on the food, a little pinch will do. You don't have to have that much salt. Reduce alcohol use. Yeah, I know, everybody like to go party Friday night or Saturday night or something of that nature. It's football season, you like to watch the games, but decrease the amount of alcohol you're actually consuming. Make sure you exercise. Even if it's just getting up to go walk during a commercial break. Most commercials last around 2 minutes, 2.5 minutes. So getting up and doing some type of exercise during a commercial break will help you out. Stress management is another one. Learn how to control that stress. If the lifestyle modifications doesn't work, then we say, let's do the pharmaceutical therapy. When it comes to that, there are so many different medications out there. If you're on a medication now, that's something to think about. Which of these are you actually taking? And if you're taking a med, do you know what it's actually doing? Because a lot of people will go to the doctor and the doctor say, hey, this is the med you need to take. Then you're like, okay, and you're just taking it. You don't know what it truly does. So we have a simple breakdown of the different types of meds for high blood pressure. Your first one is your diuretics. When it comes to your diuretics, you have your HCTZ and you also have your Lasix. And this is helping with the kidneys to prevent reabsorption of sodium. So basically, it's preventing the kidneys from absorbing all the sodium that's in the food. You have your beta blockers. And when it comes to beta blockers, you have two of them. Notice they end in OL. And what this lets us know in the medical profession is, hey, it's going to slow down the heart rate. As it slows down the heart rate, it's going to open blood vessels. So that's what your beta blockers do. They reduce the workload of your heart and blood vessels so that it opens up the blood vessels. As it opens up the blood vessel, it doesn't require that heart to squeeze as hard to push fluid through. Think of it like this. Right now, your blood is being pushed through a straw. So that, you know how small the opening of a straw is, it's being pushed through a straw. Now you take this medicine, your beta blockers. When you take it, it opens up. So you go from a small straw to a bigger straw so more blood can flow through. Since more blood is flowing through, the heart doesn't have to squeeze as much, which is what we want. You also have your alpha blockers. You may be on this one. It causes vasodilation. I tell people when looking at medical terminology, break it down. Vasal just means vessel. Dilation means to open. So opening the vessels. So that's what your alpha blockers, that's pretty much what all these medications are doing. They're opening the vessels. You have your vasodilators. Your very common one is nitroglycerin. And this is very common for those who has high blood pressure, but if you have chest pain or angina or something of that nature, you're probably on nitroglycerin. You have your ACE inhibitors, and it works by blocking a substance in the body that causes the blood vessels to tighten. Again, like I said, we're not getting too much into the physiology, so I'm trying to keep it as simple as possible. So you may be on an ACE inhibitor, and notice what it ends in. It ends in a PRIL. Your calcium channel blockers. When it comes to your calcium channel blockers, they stop calcium from entering the cells of the heart and arteries, allowing the blood vessels to relax and allowing blood to flow through. So we went over medications. Next one, we're going to actually show you how to take your blood pressure. There are different devices. We're going to show you how to take it. And if you go to the doctor's office, how they take their blood pressure. I'm going to make sure you have a good understanding of that. And that's going to be in our next video. See you then.